Hello everyone, myself Dr. Parth Goswami. I am the consultant pathologist and hope this video will find you all in a good health. Today I am going to teach you about type 1 hypersensitivity reaction. I have already discussed what is hypersensitivity reactions. So the hypersensitivity reaction is exaggerated, inappropriate and triggered immune response, right? It is an excessive immune response. So among that all hypersensitivity reaction, today we are going to discuss about type 1 hypersensitivity reactions. The learning objective for today's topic of discussion is to understand the definition of type 1 hypersensitivity. Then we will understand the basic pathogenesis or mechanism of that hypersensitivity reactions. And we will see the clinical manifestation, diagnosis and the treatment aspect of type 1 hypersensitivity reactions. So first of all, we will start with definition. What is type 1 hypersensitivity? So basically, you might have suffered from allergic cold sometime in your life. So that is the allergic type 1 hypersensitivity reaction. So as far as the definition is concerned, this particular hypersensitivity begin with antigenic exposure, right? The antigen here is known by the name allergen. So following the exposure, you will have the IgE antibody production from the B lymphocyte, which will bind to the mast cell. Here the mast cell is the main important cell of type 1 hypersensitivity reaction. And whenever the person, this is known by the name sensitized person, right? When the IgE antibody bind to the mast cell, it is a sensitized person. So whenever there is a second time re-exposure of that particular antigen, there will be rapid immunological reaction within minutes. That is known by the name immediate type 1 hypersensitivity reactions. And here the reaction is immediate because the antibody is already bound to the mast cell. So whenever you have the re-exposure, there will be degranulation of the mast cell and the content of mast cell will be released in the surrounding atmosphere, which is responsible for clinical manifestation. So this is the complete definition of type 1 hypersensitivity. I will explain its pathogenesis in very detail in the subsequent slide. Alright. So basically type 1 hypersensitivity is an allergic or atopic disorder, right? It's a pure allergic disorder. Alright. And here the reaction is due to the exposure to antigen, particularly environmental antigen. It will trigger the excessive immunological response, which is known by the name allergen. So here the environmental antigen which leads to type 1 hypersensitivity reaction is known by the name allergen, right? All right. And here, as we know, the immunoglobulin that is produced is IgE variety. All right. So these are the different antigen to which type 1 hypersensitivity can develop. So these are the example of allergen. Here the allergen could be household dust mite. It could be certain animal danders or insect bite. It could be pollen or certain drugs. It could be molds or it could be certain foods like that of peanut selfies, right? So these are the example of allergen. These all are the allergen to which type 1 hypersensitivity reaction can occur. And these allergens are usually harmless for majority of the individual. The hypersensitivity will develop in a atopic individual, right? Means those individual who is genetically susceptible will develop the type 1 hypersensitivity reaction. All right. Now I will explain the complete pathogenetic mechanism of development of various clinical manifestation of type 1 hypersensitivity reaction. So first of all, the story begins with exposure to allergen, right? The reaction begin with a antigenic exposure, which is known here by the name allergen. All right. Now this particular allergen will present to the T lymphocyte, right? The allergen will be presented to the T lymphocyte with the help of antigen presenting cell, right? Sorry, again I am telling. So first of all, there will be antigenic exposure to the individual, right? And in a genetically susceptible individual, this antigen will be carried out to the T lymphocyte with the help of antigen presenting cell. And here the antigen presenting cell is dendritic cell, right? So dendritic cell will act as an antigen presenting cell, and it will present the antigen to the T helper lymphocyte. We know very well that T lymphocyte could be T helper lymphocyte or cytotoxic lymphocyte. So here the antigen is presented to the T helper lymphocyte, particularly Th2 variety of the T helper cell. And you know very well that T helper cell will will produce certain cytokines like that of interleukin 4, interleukin 5 and interleukin 13. So here the these particular cytokines will stimulate a B lymphocyte. We know very well that if you have not seen that lecture until now, then first see my lecture on T lymphocyte. We know very well that T helper cell, particularly Th2 cell, whenever producing interleukin 4, 5 and 13, it will stimulate a B lymphocyte, right? So on the B lymphocyte stimulation, you will have antibody production. So the T helper cell will stimulate a B lymphocyte for the antibody production. Particularly, it will stimulate the B lymphocyte for the production of IgE variety of antibody. The B lymphocyte will get converted into plasma cell, and plasma cell will secrete IgE variety of the antibody. Right? Now, this particular antibody will bind to one special cell, that is mast cell. It is allergic cell. So this antibody will bind to this mast cell, right? So now we have the IgE antibody which will bind over the mast cell, and this particular process is known by the name sensitization of an person, right? So reaction doesn't develop on the first time exposure of antigen or allergen, right? This is the sensitization. This process is known by the name sensitization. So in the type 1 hypersensitivity, we have two variety of reaction. First of all, there will be sensitization. Now guys, what happen whenever you have the second time exposure of antigen, whenever you have the re-exposure of antigen, it will directly bind to the IgE antibody which is already bind to the mast cell, right? We already have the antibody bound to the mast cell. So now on re-exposure of antigen, it will directly bind to this antibody, and so you will have release of inflammatory mediator from the mast cell. There will be mast cell degranulation, right? There will be release of the mediators from the mast cell. So this released mediator is responsible for the various clinical manifestation. So this is about the basic pathogenetic mechanism of type 1 hypersensitivity reaction. So again I am summarizing. First of all, you have the antigenic exposure. That antigen will be presented to the T lymphocyte with the help of antigen presenting cell, right? The T helper 2 cell will activate the B cell to get converted it into plasma cell, and so the plasma cell will produce the IgE variety of antibody. This particular antibody will bind to the mast cell and it will coat it, which is known by the name sensitization. And on re-exposure of the antigen, right, on re-exposure, there will be immediately release of the mediator of mast cell. There will be mast cell degranulation. So the release mediator is responsible for type 1 hypersensitivity reaction. So this is about the pathogenesis of allergic reaction. Now here additionally, the interleukin 5 can activate eosinophil, not mast cell. You have to remember that here released IL-5 will activate the eosinophil. So eosinophil is also another cell of type 1 hypersensitivity. There will be release of interleukin 13 also, which stimulate the epithelial cell for excessive mucus production. That's why the allergic individuals having the more cold or more cough, right? The secretions will be there because of this activation of epithelial cell. Now friends, here you have to remember that This particular process is known by the name sensitization. You have the IgE antibody which coat the mast cell, right? Whenever you have the re-exposure of that allergen, you will have the release of the content of mast cell, and that particular released mediator will be responsible for various hypersensitivity reactions. And the released mediators could be histamine or certain enzymes, right? We will see it in detail in the later on in the slide. But friends, remember that in this particular process there could be production of new inflammatory mediator as well, right? These are the preformed mediators which is already present in the mast cell. But during this process, a new mediator also can be synthesized and released. These newly synthesized and released mediators are prostaglandins and leukotrienes, right? These are the different cytokines that will produce newly. It is not already present in the mast cell. All right. And these released mediators can lead to clinical manifestation of hypersensitivity reactions due to vasodilatation. It could be due to increased vascular permeability, or it could be due to smooth muscle contraction. We will see it in detail later on in the slides. All right. Now, exposure to the antigen or allergen could be in the three way. It could be by inhalation through the respiratory tract, through the nose, or it could be ingestion by the mouth, or antigen can be injected into your body through the artery or vein. So these are the three way of exposure to the antigen, following which type 1 hypersensitivity begins, right? All right. Now, these mast cells are usually concentrated near blood vessels and nerves and in the subepithelial tissue. So you can imagine that these are the common sites of type 1 hypersensitivity reactions. All right. Now you might have questioned that why produce Ig antibody will bind to the mast cell only. Why it have specific tendency for the attraction toward the mast cell. So that is because of presence of one receptor over mast cell, which is Fc epsilon receptor. Over the mast cell we have this receptor, and due to which Ig antibody will directly bind to the mast cell, which is having this receptor is having high affinity for IgE antibodies. All right. And eosinophil also having the same receptor for binding of the IgE antibody. But eosinophil plays a major role particularly in the helminthic infection. All right. So now we know very well that over the mast cell we have the bound IgE antibody in the sensitized person following the allergen exposure. So now whenever there is a re-exposure of antigen, it will directly bound to this IgE variety of antibody, and so the mast cell content will get released, right? So the mast cell could have preformed mediators, or the mediators could be newly synthesized. So we will see one by one which are the preformed mediators and which are the newly synthesized inflammatory mediators. Inflammatory mediators. So the preformed mediators or the primary mediators that is already stored in the mast cell, and it will directly get released whenever you have the antigen exposures, are four types, right? And effects start after the release of these granules from this mediator release from the mast cell. So basically there are four type of primary preformed mediator in the mast cell. So these are the vasoactive amines, enzymes, proteoglycans, and neutrophil and eosinophil chemotactic factor. We will see each primary mediator one by one. So the first primary mediator is histamine. Histamine. It is vasoactive amines, right? The serotonin is also one of the vasoactive amines. So this particular histamine or vasoactive amines will lead to vasodilatation, means the dilatation of blood vessel, due to which you have the congestive symptom in the type 1 hypersensitivity reaction. Second one, there could be increased vascular permeability, which could be responsible for the edema, right? There could be smooth muscle contraction because of this amine. Particularly, it will constrict your bronchial muscle, right? Bronchial smooth muscle can get constricted. So because of which patient can feel difficulty in breathing, which is known by the name dyspnea, right? Because of interleukin 13 production, we already know that epithelial cell will get stimulated, and so there will be increased mucus secretion, particularly from the nasal, bronchial and the gastric gland. So the patient can have common cold, right? It could Patient can have mucus secretions from nose, or patient could have diarrhea, right, because of released of secretion from gastric gland. So this is about the vasoactive amines. Second one is enzymes, which is second preformed mediator. So the name of enzymes include protease, particularly chymase and tryptase, acid hydrolase and the kinin. And these particular enzymes can activate the complement system. So it can lead to tissue damage, which could be responsible for various manifestation of type 1 hypersensitivity reaction. Alright. Third preform mediator is proteoglycans, particularly heparin sulfate and chondroitin sulfate. So these are the various preformed mediators, right? There are four type of preformed primary mediators: vasoactive amine, enzymes, proteoglycans, and neutrophil and eosinophilic chemotatic factor. All right. Now I will discuss something in detail about secondary mediators, that is newly synthesized inflammatory mediator in the type 1 hypersensitivity reactions. So the newly synthesized mediators, which is not already stored in the granules, are cytokines or lipid mediators. The cytokines include interleukin 1, TNF, interleukin 4, 5 and 13, while the lipid mediators are leukotrienes and prostaglandin, among which the prostaglandins and leukotrienes play a vital role in the allergic inflammation, and that's why in the treatment of most of hypersensitivity reactions, the prostaglandin and leukotriene inhibitors are used commonly, right? All right. So, what is the mechanism of action of leukotrienes? So, particularly leukotrienes C4 and D4 are the main leukotrienes for the allergic inflammation. And these particular leukotrienes are very powerful mediators. You can imagine the powerfulness of this leukotriene by this sentence, that it has the greater than 1000 time potency as compared to the histamine, right? The effect is 1000 times more as compared to histamine. So it is a very powerful inflammatory mediator, and that's why it is known by the name slow reacting substance of anaphylaxis, right? It is a very powerful mediator which can lead to allergic manifestation in a severe way, right? The allergic manifestation due to these leukotrienes could be severe, and the mechanism and the effect is same like that of histamine, particularly increased vascular permeability, vasodilatation and bronchial smooth muscle constriction or mucus secretion, right? The effect is similar to histamine. Okay, more or less is similar. The second leukotriene is leukotriene B4, and this particular leukotriene is chemotactic for neutrophil, eosinophil and monocytes. Here the word chemotaxis means a collection of cell towards the site of injury, right? Whenever you have the antigen exposure at that site, these particular three cells could get collected, and they will get collected because of this leukotriene B4. So that process is known by the name chemotaxis. It's the unidirectional movement of inflammatory cell towards the antigenic exposure. So that function will be carried out by leukotriene B4, and the prostaglandins can lead to mucus secretion and bronchospasm, and this bronchospasm could be lethal, because of which patient can have dyspnea, right? This effect could also be due to leukotriene B4, sorry, leukotriene C4 and D4, right? All right. So, in short, I want to share that because of leukotrienes and prostaglandins, you can have vasodilatation, increased vascular permeability, mucus secretion, and bronchospasm. This bronchospasm is a very lethal for type 1 hypersensitivity individual. So sometime in a severe case patient can die also. All right. So now I will teach you which are the systemic clinical manifestations. Which are the manifestations? So whenever the type 1 hypersensitivity reaction is severe, right? Whenever it is acute and severe, it could be fatal, right? And in the severe case of type 1 hypersensitivity reaction, individual can develop a variety of clinical manifestation. These particular manifestations are acute, right? It could be fatal, and this systemic manifestation is known by the name anaphylaxis. It's a most severe form of type 1 hypersensitivity reaction, which is known by the name anaphylaxis, right? And this severe systemic manifestation usually due to injection of antigen in a sensitized individual, right? It is usually not due to inhalation or ingestion. Basically, it is due to injection of antigen. And this manifestation could be as severe that it can lead to shock and death of an individual. And small dose of antigen is enough to cause such reaction. So, what could be the etiology for such systemic anaphylaxis? So, it could be due to antisera injection, injection of drugs like penicillin, hormones and enzyme administration, or it could be food allergen like that of peanut and shellfish. And sometimes bee sting and insect bite also can lead to systemic severe anaphylaxis. And these are the clinical features of systemic anaphylaxis, right? A patient can have itching, patient can have hives, which is a form of urticaria. You can see that elevated red rash over the body, right? Patient could have difficulty in breathing because of bronchospasm by leukotrienes or prostaglandin, right? Patient could have difficulty in breathing due to bronchospasm. Patient can have vomiting, right? Patient can have diarrhea. And because of all these, the patient can undergo shock, right? In the type 1 hypersensitivity, the blood circulation to the or vital organs are get compromised, so patient can develop shock. And because of vomiting and diarrhea, the blood volume can be lost, right? And because of fluid and electrolyte loss, patient can go into hypovolemic shock as well. So here the patient can develop anaphylactic or hypovolemic shock, and finally death can also occur. So it is a very severe form of systemic anaphylaxis, right? So I want to say that basically clinical feature can be divided into two variety, a local manifestation or systemic manifestation, right? And the systemic manifestation is somewhat severe, while the local one is not severe, and it is very easy to understand, right? So local one is not a matter of worry. All right. So which are the local clinical manifestation? So the local manifestations are seen usually where you have the site of allergen exposure. Usually the reaction develop at the site of entry of allergen. Suppose if the allergen entered through the nose, then patient will develop rhinitis, right? Patient will have cold. If it is entered through conjunctiva, then patient can have conjunctivitis, right? And here usually the manifestation is due to inhalation or ingestion of food, right? Inhalation of pollen, animal dander, dust, etc. And sometimes due to food ingestion. This particular manifestation not seen due to injection, right? It is usually due to inhalation or the ingestion, right? All right. So this is the complete list of systemic and local hypersensitivity reaction. So the localized hypersensitivity reaction, localized manifestation is seen in bronchial asthma, then hay fever or conjunctivitis or rhinitis, then urticaria, atopic dermatitis, right? In which the individual have rash because of exposure to certain allergens like that of detergent, right? Angioedema and allergic gastroenteritis by food ingestion. These are the localized hypersensitivity reaction. But whenever you have the more profound systemic manifestation, it is the systemic hypersensitivity. And the examples include injection of antibiotics, mainly penicillin, then foreign proteins, hormones, or hormonal or protein administration like that of antisera injection, or it could be due to bee sting or insect bite, and sometimes due to food. Mainly it is due to injection of antibiotics or drugs. All right. So how will you diagnose the type 1 hypersensitivity? So for that you have to take a detailed clinical history and the physical examination has to be done. Various form of allergic testing nowadays available. Skin prick allergic testing, it is known by this name, skin prick allergic testing, right? In the type 1 hypersensitivity, IgE antibody will produce excessively, so its concentration in the serum can get elevated, so you can investigate with IgE antibody estimation. All right, now we have seen that basically you have the variety of clinical manifestation and it will develop immediately, right? It develop immediately within 5 to 10 minutes, and usually such reaction will subside in maximum 60 minutes, right? But suppose the reaction, the I want to say the clinical manifestation develop after few hours or after few minutes and sustain for many days or many weeks, then it is known by the name late phase reaction, right? These are the immediate phase reaction in which your symptoms will get relieved in 60 minutes maximum. But whenever you have the profound sustained inflammation, it is known by the name late phase reaction, and this prolonged inflammation could be due to collected leukocyte. Particularly you will have eosinophil accumulation at the site of allergen exposure, and this particular leukocyte will sustain the inflammation without any additional exposure to antigen. You will not have any new antigen exposure, but the inflammation will sustain for several weeks. That is known by the name late phase reaction, and this particular reaction is carried out mainly by eosinophilic allergic cell, not by mast cell. All right, and remember one interesting fact, that eosinophil contain charcot-laden crystal, which is composed of galactine 10 protein. So in the asthmatic patient, right, in the asthmatic patient you will mainly have eosinophil accumulation in which you have the late phase reaction. So in the asthmatic patient, this eosinophil will secrete this charcot-laden crystal in the sputum. The asthmatic patient have more cough, so in the cough these crystals will get released, which consist of galactine 10 and which can induce the inflammation. So this is known by the name late phase reaction, and this is very important MCQ, that this particular crystal seen in which condition. So it is seen in asthma, right? It is seen in sputum. All right, so you can now understand that eosinophil is very important cell in the late phase reaction. So you have to remember that there are two important cells in the allergic manifestation, right, in the type 1 hypersensitivity reaction. The one is mast cell and another one is eosinophils, right? This eosinophil can produce a different mediators like that of major basic protein, eosinophil chemotactic protein, leukotriene C4 and the platelet activating factor, all which can lead to epithelial cell tissue damage or inflammation. We already know that leukotriene C4 can lead to inflammation through vasodilatation, right? It can lead to bronchospasm as well. It can increase vascular permeability as well. So these are the very powerful inflammatory mediators. It can lead to inflammation, right? And the stimulus for the eosinophil recruitment is eotaxin, right? The chemotactic stimulus is eotaxin. Because of effect of eotaxin, the eosinophil get collected at the allergic site. All right, now I will introduce you with one special word, that is non-atopic allergy. What do you mean by non-atopic allergy? So see friends, usually for the type 1 hypersensitivity reaction, you need a antigenic or allergen exposure. The allergen could be foods, could be pollen, dust, molds, right? Injection of drugs, etc. But sometimes in certain individuals, the immunological reaction, right, this type 1 hypersensitivity reaction will occur without Th2 response or without IgE antibody involvement, right? You will have direct clinical manifestation because of temperature or exercise like stimulus, which is obviously a non-antigenic stimulus, right? because of excessive temperature or cold temperature or by the excessive exercise, you will have allergic manifestation. So that is known by the name non-atopic allergy, where you doesn't have any antigenic stimulus, or you doesn't have any T cell or B cell stimulation or antibody production, right? But still you will develop the symptom, and this is seen in 20 to 30% patient of immediate hypersensitivity, which is known by the name non-atopic allergy, where you doesn't have any antigenic exposure and still you will develop symptom because of temperature or exercise, excessive temperature or exercise, right? So why such happen? Because this particular allergy, non-atopic allergy, occur because the mast cell are abnormally sensitive to the temperature or exercise. So without any Th2 symptom, without any T lymphocyte or B lymphocyte involvement, the mast cell will degranulate its content by exposure to temperature or exercise. So this is known by the name non-atopic allergy, which is a very important MCQ. Alright. Now again, one important terminology, anaphylactoid reaction. What do you mean by anaphylactoid reaction? So I have already described the pathogenesis of type 1 hypersensitivity, in which you need a IgE antibody production, right? There should be IgE antibody production because of B cell stimulation, and the B cell stimulation occur because of T helper cell activation by allergen exposure. But certain foreign agents, certain antigens do not require any processing. They do not require Th2 T lymphocyte response. They do not need a B cell activation, and they doesn't need IgE antibody as well. They will directly degranulate the mast cell content, which is a non IgE dependent reaction. So here you will have the degranulation of mast cell, right? So the already stored vasoactive amines will get released from the mast cell, and it will lead to clinical manifestation, which is known by the name anaphylactoid reaction. And this response is short lived. It is very short reaction because here you doesn't have any new cytokine synthesis. So it's a non IgE dependent reaction in which you have directly mast cell degranulation. All right. And now I will show you some of the golden points. So to summarize, the type 1 hypersensitivity reaction is nothing but it's a allergy, right? It's an allergic reaction. The most important cell in the type 1 hypersensitivity is the mast cell, and the second number important cell is eosinophil. The most important cell in the late phase type 1 hypersensitivity is a eosinophil, which is involved in late phase reaction, and here you will have persistent of inflammation for many days, right? All right. The PK reactions, Theobald-Smith phenomena, the Suits-Dahl phenomena are also the example of type 1 hypersensitivity reaction, and it can be asked in a MCQ sometime, right? These three reactions could be an example of type 1 hypersensitivity. All right. So this is all about the type 1 allergic hypersensitivity reaction. I hope that you will enjoy this video, and sorry this video is somewhat long. Thank you very much, and see you soon in the next video.